health center is really where people go to get daily care, particularly if they live on campus. The health center is their primary care area. This decision was made to renovate rather than start new. It really represented to the student body reusing what we had as opposed to building something fresh. And that was really important to the student body.
I began working on the project in 2006 when design began. In 2007, I was approached by a student, Tony Bautista, and he sort of challenged me that we should make the building green. And I went into my explanation of why we couldn't do that in terms of budgetary constraints. And that's the message that I'd given to Tony, was that it was a money issue and that if we could, we would. And so he came back and said, well, Josephine, what happens if the students came up with the money to pay for it? And I said, well, then I would do my part. He and a number of students on campus decided to put together a petition, a measure referendum. Measure 35 passed, and that was for greening of the health center. And it passed overwhelmingly.
It was mandated by a student referendum to be a LEED Silver building. In fact, the team achieved gold, which is really quite wonderful. The project involved not only remodeling the existing building, but adding a new wing. It's sort of laced into the existing forest, and it creates this healing space. And the whole building, the circulation system of the building relates to that healing space. In the existing building itself, we were able to save about 88% of the total shell and core. In addition, we were able to save approximately 34–35% of all the interior structures. So that's good. That's a very sustainable thing to do. We were able to achieve a 40% reduction in the use of domestic water. We were able to achieve a 60% reduction in irrigation usage by using native plants. We had stormwater retention planters in the courtyard. It allows you to capture the stormwater and release it to the aquifer in a much more controlled and, frankly, a much cleaner way.
I was very grateful for the support that I received from the Sustainability Office and the Student Environmental Center.
We're at the university in a really unique position where we have students who can make things happen that staff wouldn't be able to do. And then we're able to pair them with staff who have the resources to implement and make those projects happen.
And when that upswell of students comes in and says, this is a priority for us, it helps make it a priority throughout the entire campus.
I knew Josephine from previously, and I felt that the health center was the greatest project that I could work on campus. The focus of my project was to really engage the students on multiple fronts through posters and wayfinding signs and things like that.
How you doing? Good.
Alex, our class is going to come today and we're going to show them a tour of the health center so that they can have a real experience of a sustainable building.
All right, let's go.
The website is meant to exist for the wider community, and it goes through most, if not all, of the information that is actually physically present on site.
So you can see
There's a great pride here. I mean, it's not just about the building. It's, you know, when you think about all the interpretive signs, you see the staff here that enjoy the building. I mean, to me, it's just a sense of pride that I see when I walk here.